Welcome back. We're talking about unsafe student practice and the clinical setting. So our objectives include identifying policies and prevention strategies for unsafe nursing student practice, as well as identifying legal ethical consideration and strategies to manage potential student behavioral performance issues. So let's begin. Um, According to the Nebraska Methodist College Handbook, the student will demonstrate professionalism and safe practice at all times in the clinical setting and during scheduled validations in the Nursing Skills Lab. Any behaviors inconsistent with this expectation will be documented and remain a part of the student's clinical performance record throughout their nursing program. So what this is saying is that students are expected to demonstrate professionalism and safe practices in the clinical setting, wherever that is, and also in the simulation lab, which occurs in each clinical course periodically. So the thing about unsafe and unsatisfactory clinical practice, as you would know, is that it puts not only the students at risk, but also patients and staff nurses, and nursing instructors. Furthermore, it sends unprofessional messages to our clients. Our students represent the college wherever they are, and they are also representing the facilities in which they're performing clinical. The goal is to uphold our students to the same standards as are expected in practice, because they will become practicing nurses and will be expected to adhere to a professional expectations of practice. So in order for this to happen, then we need to know and follow the standards of practice and defer to hospital policies and procedures. Certainly the college has practices and policies for safety, as does the clinical areas as well. So between the two of us, we've got a pretty strong set of policies in place to maintain safe practice. Consistently upholding best practices when role modeling to students. And sometimes you'll hear students make comments about, well, that's what the book says, but I've never seen that in real life. Well, that's something to pay attention to. Oftentimes, I think the student doesn't have the full picture, so they don't really know what they're seeing in real life, or recognizing how what is occurring in real life is in fact related to what the standard expectations are. We need to keep in mind that students are not independent practitioners. They are not licensed, and therefore a nurse must be present for certain tasks and procedures. And as such, we need to be aware of what students are allowed to do and are not allowed to do independently. For example, RNs must be present while students are administering all IV medications, and that's a policy from the college. Now, at Lasting Hope, we typically are not administering IV medications, so students would not have a role in that. However, they may administer waste or co-sign controlled substances, and they may witness additional medications such as insulin. And within the clinical agency, they can document patient outcomes. They can also identify changes to care plans with the RN input and document their assessments. So these are some of the broad pictures of student roles and performance. In regard to prevention, we need to know what the course syllabus and student expectations say. We also, and this is key, need to know who to contact. Who are your resources? And we're really lucky at Lasting Hope. There's a resource manual at virtually every unit, so they can know what's expected and who to contact, and also know when to ask for help or support. And what I think is important here is that we need to be documenting. Document. But again, we've got this nursing student handbook and the facility handbook as well from the clinical agency. So we've got documentation in place to review when it comes to looking at prevention of unsafe practice. As I said, there's legal ethical considerations and there's policies with the clinical nurse educator liability, and it's the same as with an RN. We must meet the standard of practice. We must be educationally prepared and be clinically competent. With legal ethical concerns, students are oriented to HIPAA at the very beginning of their nursing education, and all or suspected HIPAA violations should be reported to the DEU faculty coordinator, myself, Connie, immediately. Students tend to be very, very sensitive to that, very aware of client confidentiality, and we certainly hit that hard in terms of reminding them about confidentiality in healthcare. Now, another aspect of legal ethical is the student's privacy rights, in which FERPA restricts disclosure of students' academic information to individuals. So we don't disclose any of that, and students need to know that, in fact, their information is being held in confidence as well. And along with that is the evaluation statements occurring in regard to student performance. And their evaluative comments are not to be shared with individuals other than the student themselves, the DEU faculty, and the coordinator. Negligence, liability, and unsafe clinical practice. We've got a process for unsafe, unsatisfactory clinical behaviors, and part of that process includes a process for a clinical contract, which is spelled out very clearly what the expectations are for the student. And there's also a point system in place at the college where you can get 1 point for a minor infraction, and it will stay on their record. But once they graduate, if there have been no further points, it's absolved. Student behaviors, when there's questions about student behaviors, we want to have the staff nurse instructor address student behaviors as they observe them. And we also want you to let me know about it so that I can address it or follow up as well. And oftentimes I think a three-person approach here in terms of having the student there with you as the staff instructor and me as the faculty is a pretty effective way of having clear and consistent communication for any problems that we're trying to prevent or address. Now, in regard to challenging student situations, there certainly can be student situations that can be challenging and can get in the way of their effectiveness. For example, the emotional student. Oftentimes there's some underlying reasons for the anger or the vulnerability that is evident. And along with that anger and vulnerability often includes tears, tears of frustration, tears of vulnerability. The underlying reasons could include unrealistic expectations or feelings of faculty being unfair. Probably the most commonly seen one would be unsettled personal matters. And what I think happens here many times is that just the nature of the setting and the nature of the conditions which the students are exposed to might trigger some unexpected, unresolved issues in their own life that they thought they had dealt with, but in fact is resurfacing now. And so that would result in unsettled personal matters. And it's an area that can be addressed and resolved. So with the emotional student, we want to identify whatever the underlying causes are that are contributing to that, and then be aware of changes in behavior that are going along with that. That might be what we see first, and then we'll want to identify those causes. But with behavioral changes, we want to catch it early and correct it. With an emotional student in the clinical setting, it's best to remove that emotional student, give them a break, so to speak, have them leave the unit and maybe go to the student conference room or possibly the relaxation station. and just kind of get a grip, get a sense of restored perspective so that they come back to the unit. Once again, I'm so in awe of the services and options that are available at Lasting Hope in terms of the relaxation station with the neck, the heating pad for the neck, or massages or whatever. It's a wonderful way to take care of yourself in a very stressful job. So I commend you for that. And again, we have options for the students as well, just asking them if they want to maybe go back to the conference room or go and get some water to drink or something, and then come back in 10 or 15 minutes when they're feeling a little more composed. With the emotional student, we'd want to talk to that student privately, listen to what their concerns are, and offer additional resources if necessary. We want to reinforce that the student behavior should not disrupt the patient care. Using therapeutic communication, we can oftentimes get to what the concerns are for the student and maybe help them resolve them enough to get through the rest of the day. This sort of thing often results in a meaningful learning experience for the student, to realize that yes, I was over emotional and I can set that aside and deal with it later. Right now I've got to be tending to this, for example. One other aspect I'd just like to comment on is additional resources, and certainly you can pull me into the conversation and I can help get the client in touch with resources at the college. However, Lasting Hope has some pretty wonderful resources right on site, and Eric Hill meets with the students usually maybe 3 times or 4 times in the course of the rotation, and guides them through some relaxation and stress reduction, and it can be very helpful. And he's also commented at those sessions that he would meet with students individually if there is a need or desire for that. So once again, I am just very appreciative of what happens at Lasting Hope. Now, another aspect regarding student concerns would be the unprepared student. And students will be made aware of course expectations during orientation, and pre-labbing is a site-specific expectation. Not all of our clinical sites require pre-labbing, however, some do. Now, the students who are going to a DEU do not pre-lab the night before, because they will come in and get their information at the beginning of the shift with morning report, just like the nurses do. And at that point, they will begin to process what needs to happen and what's going to be the priority. And so it'll be kind of on the job. Students who show up late or do not bring required nursing care items to clinical are considered unprepared. And you'd want to talk with the student about that. Actually, they could be told to go home, to leave the unit, or it's possible you might say, well, go and get your resources and come back. We'll discuss it in 10 minutes. So you've got some options there, but the thing is, if the students don't have what they need to do clinical, then they're not prepared and they should not remain on the unit. Now, if you see students who are wanting to use clinical time to complete their paperwork, again, that's an unprepared student and they're not participating in patient care, which is what they're there for. So that is a situation you'd want to redirect immediately, and also notify me about. So the repeating student can be a student issue, and if that is the case, the student who is repeating a course may have unresolved feelings toward the faculty or the institution. However, typically, I don't believe the nursing staff in the facility are even aware of this because it's not disclosed. So the student may have some feelings. It might come out in some ways, but again, you may not know what's causing it or what the issue is. Sometimes the student who is repeating might appear to be stronger clinically than peers. And again, that's just something you might observe or not. But as I said, we don't disclose this information, so it typically does not impact the clinical setting. Unsatisfactory clinical performance. Students who consistently fall below minimal requirements for clinical expectations. Now, obviously, students need to have a few shifts to get used to the DEU and how they're functioning and who they're working with. They'll probably be working with different nurses throughout their rotations, so that will be another area to become familiar with. However, if there's behaviors, problematic behaviors that persist, then they need to be addressed sooner rather than later. So report these concerns early in communication with the student, but also with the DEU faculty. And again, we've been talking about the evaluation process, and if there's areas where the student are receiving a 1 or a 2, then again, those are issues that we need to resolve. Typically, if a student is unprepared and they get a 1 on 1 week, they would need to improve that the following week. The same with if they got a 2. If they got a 2, meaning it needs improvement, we would expect to see that it has improved the following week. If it hasn't, again, that's something you'd want to discuss with the student, note in their evaluation, and also discuss with me about. Student misconduct. Unacceptable or improper behavior, especially by an employee or professional person. Types of misconduct can be behavioral, administrative violations, or criminal acts. Behavioral can be discourtesy or not paying attention. Could be arriving late or having poor hygiene, or eating and drinking at inappropriate times or places. And that's something that I would like you to address if it occurs, and I think that you would address it only once, because then the student should know what the expectation is. I try to discourage them from bringing their bottles of water or whatever their drinking receptacle is onto the units. Sometimes they do, and again, that's something that you can certainly address with them. Cell phones have no place in the clinical setting at all. And if they're taking long breaks or asking to leave early, again, that's a behavioral issue that we'd want to document. If there's more than one student on the unit, you might suggest that the students do not take their breaks together. Typically, that break seems to become a little longer if it's shared between 2 friends. Okay. Behavioral concerns, one of the key aspects here is communication, early and honest communication. Communicate with the student and the faculty about the behavior that is concerning, and focus on why changing that behavior is important. Because we know that behaviors that you see in a nursing student, if it is not brought to their attention and if they're not held accountable for that, those behaviors will continue as they start practicing as a registered nurse. Administrative violations could include false documentation, and for that reason, I want to remind you to always review your students' documentation for accuracy. Sometimes it might be that they really didn't know the words to use, and so the way they phrased it was less than accurate, and that becomes a teachable moment. But you also want to be aware of watching for actual false documentation, something that did or did not actually happen. Acts that endanger self or someone else. Or physical or verbal abuse, and that is very rare. As with other settings where there's physical or verbal abuse, you'd want to report it to the faculty or the coordinator and remove the student. Notify security if there is a threat of any sort. Criminal acts could include threats or intimidation, possessions of weapons, or theft. Again, these are extremely rare. In the event that you suspect that there's some influence of drug or alcohol, again, that's something you'd want to report immediately, and we would remove the student from the clinical setting. So strategies for managing misconduct. Well, we want to gather and document appropriate information. Documentation is always important, whether we're documenting client status or what's going on within and around a nursing student in the clinical setting. We want to engage the student in conversation and comment on those observed behaviors, bring them to the student's attention, and focus on the behavior that you're seeing, not on the student themselves. We'd talk about what the required behaviors are, whether it be in regard to timeliness or attitude or professionalism. We'd also outline the consequences. And this, to me, this whole process seems like this is a situation that would be handled by both the staff nurse instructor and the college faculty instructor. So again, we want to work together and again refer unresolved issues to the DEU faculty immediately or at any time. It's not up to you alone to deal with situations of student misconduct. You might be the one to notice it, to recognize it, and to be the first one, in which case, again, you want to pull me in as well. And each situation would be handled on a case-by-case basis. So with managing misconduct, again, we want to communicate the behavior and the concerns. Why is this concerning? We'd also want you to be contacting the faculty, such as myself, the DEU coordinator, for ongoing concern or support. Because we need to remember that while these are nursing students at this point in time, they will become your peers in a very short period of time. And so you are helping to shape the future of the nursing profession. And we appreciate your involvement with the students. With that, we'll be moving on to one more session very shortly. Thank you again for your attention. And if you've got questions about what we've been talking about, please make notes and we will discuss them in our time together at the beginning of the semester. Thank you very much.